Hello everybody and welcome to the Asthma Consultation Survival Guide for GPs. My name is Uja and I'm a GP myself, which is a real disadvantage when it comes to asthma, because in GP training we learn about the rhymes of Saba, Laba, Lama, but actually we are left to our own devices to find out how we lead our asthma consultations when it comes to real life. So I'm sure you've been in the situation before when the patient comes and says that, "Oh doctor, my inhaler is not working, my asthma is worse than ever." So as a good doctor, you check his prescriptions and you realize that Mr. Fraser is taking a Frenzy Breeze Fast Haler 1 puff BD. A little bit of panic mode starts because you have no idea what kind of medication is in the Fancy Breeze, but you manage to maintain a confident smile. And because you're an experienced GP, you use your survival techniques. Survival technique number 1. You realize that Mr. Fraser is on 1 puff BD, so no problem. Just take 2 puffs BD, Mr. Fraser, and if you're not better in 2 weeks, see the nurse. Well, if Mr. Fraser is an asthmatic, as he is, he's most likely to be on an ICS, inhaled corticosteroid. So what you have just done, you doubled his steroid dose, which might be necessary at some stage, but we know that most asthma patients benefit from a low dose steroid. So you might use your survival technique number 2 when you say, if this inhaler is not working, whatever it is, I'll just use the one that I'm familiar with and works most of the time. So you say, not a problem, Mr. Fraser, just take this Superstar Nexthaler. I will give you this stronger one. This will certainly do the trick. Patient is happy, doctor is happy and survived, so the asthma consultation is complete. However, it's a little bit of a tricky thing because you don't know what Mr. Fraser was on and whether this new inhaler is a step down, a step up in the asthma ladder, or exactly the same where he was before. And if you prescribe a different device, he might be a little bit puzzled how to use it. So it might not be the best choice too. You might want to use a survival technique number 3. So as a conscientious and thorough doctor who has 30 to 35 minutes per patient, you decide to take your BNF off the shelf and identify what Mr. Fraser is on. Then you locate it on the asthma ladder, BTS asthma guidelines. You find out what the next step up is, and you take out your neatly laminated local formulary. You find out what you are supposed to prescribe for that step, so you wouldn't have a slap on the wrist from the pharmacy team. And you write your prescriptions carefully. So, well, I just don't see this happening in real life, so I would suggest a survival technique number 4, where you can show off as a cool doctor. Second, you can teach some asthma for yourself, and third, make some good for your patient. And this survival technique 4 is rightbreathe.com. This is a website like the Right Move, where you find your dream home. It's the Right Breathe, where you find your dream inhaler. You can make it your favorite for easy access from your desktop. And as you explain to your patient that most of the time the inhaler is not working because it's not used correctly, something like this might be happening with the inhaler device, or the inhalation technique could be something like this. You're typing in your inhaler or Mr. Fraser's inhaler, it will come up with some results. At this point, you might want to share your screen with Mr. Fraser, turning it to him so he can recognize, oh yes doctor, this is the one with the purple cap, or yes, this is the purple disc what I use. And at a glance you see that this is an ICS LABA, maybe a medium dose in a meter dose inhaler or a dry powder inhaler If you click on the one that he is using, and it actually tells you how many puffs you are meant to prescribe you, that it needs a spacer, and it gives you a 1-minute video that you can show to the patient how to use this inhaler. Clicking on the share information button, you can actually email the whole thing to the patient, and the same one on the spacers. You have training material. It's no more than 1.5 minutes, so you can watch them together, and if the patient has his own device and spacer, you can just check and correct his inhaler technique on the spot. Following the link that you send to the patient, they can download the Right Breathe app so they can track their inhaler use. And this is my favorite sentence here: think before you prescribe, because as you know that most of the time the inhaler is not working because the technique is incorrect and the medication is not going down to the lungs. So even if you double the dose, it still lands on the throat, giving him more side effects and a hoarse voice that he won't like. So checking and correcting the inhaler technique is more likely to improve the asthma control rather than prescribing a different inhaler or a stronger one up on the asthma ladder. Yeah, final tip: it's always a good idea to ask the patient to bring their inhaler device and spacer to the consultation. You can build it into the text reminder where they are coming for their asthma consultation. I hope that you will find your asthma consultation less stressful and more enjoyable, and you will have great success stories to share. Thanks for watching. Bye for now.